is Anna Gerbers. I'm a medical doctor at Leiden University Medical Center. And together with my colleague, I will tell you something about our study that we performed with the early career scientist group of the ETENGO Consortium. This is our poster of the study, and in the study, we aim to characterize the clinical profile and disease course of patients with severe alcohol-related acute and chronic liver failure, and to compare it to those patients with an infection-induced acute and chronic liver failure. And to do so, we had access to a large database of patients included in the EF CLIF studies. And those were patients that were admitted to hospital with acute decompensation of their underlying liver cirrhosis. We studied 3 cohorts. So in the first cohort, patients with severe alcohol-related hepatitis without acute and chronic liver failure were included. These were 546 patients. And in the second cohort, patients with severe alcohol-related acute and chronic liver failure were included. And in the third one consisted of patients with infection-induced acute and chronic liver failure. So we analyzed these cohorts, and Julian will tell you about what we found.
My name is Julian Pohl, and I'm a medical doctor in Berlin, and I will guide you through our key findings. First, we have observed that severe alcoholic hepatitis-induced ACLF is characterized by a liver-centered phenotype, which means that these patients more often were observed to have liver and coagulation failure, whereas for the infection-induced ACLF, we observed a higher percentage of kidney, circulation and respiration failure. Second, we observed, even though these different phenotypes, the 28-day mortality was almost the same between both phenotypes of ACLF. Third, we saw that markers of systemic inflammation, such as white blood cell count and CRP levels, were independent predictors for infection-induced ACLF, but not for alcoholic hepatitis-induced ACLF. And lastly, we have seen that for the patients with alcoholic hepatitis-induced ACLF, for patients with infection at baseline, they were creating a phenotype in between both alcohol and infection-induced ACLF. And as you can see here, for 28-day mortality, the rates were much higher for the severe alcoholic hepatitis ACLF patients with infection compared to those without infection or infection-induced ACLF. And now I want to hand over to Anna that she can conclude for our study.
Well, thank you. Yeah, so based on these findings, we can conclude that severe alcohol-related acute and chronic liver failure is a distinct entity from infection-induced acute and chronic liver failure. They have different types of organ failures, although their mortality rates are the same. And interestingly, markers of systemic inflammation do not predict outcome in patients with severe alcohol-related hepatitis-induced acute and chronic liver failure. So that means that we need a better understanding of what drives the disease progression in this subgroup of patients, and that's what we are planning to find out in our follow-up studies. Thank you.